What's up, fam? This is your Professor Karriemah Lotus with another edition of BBI Talks. And of course, BBI Talks stands for the Black Business Influencer Talks. This is the place where Black-owned business owners have the opportunity to discuss issues that matter most to us. And I have a wonderful guest today who is exceptionally knowledgeable about the topic, which is the rise in infertility among Black women. And this is a serious topic. It really is, y'all. And this is not just a topic for the queens. It's also a topic for the kings to listen on as well and to be well informed. So without further ado, we're going to get this thing started. So infertility affects at least 12% of all women up to the age of 44. And research suggests that Black women are twice as likely to experience infertility as Caucasian women. Yet, only 8% of Black women between the ages of 25 to 44 seek medical help to get pregnant, compared to approximately 15% of her Caucasian counterpart. Yes, we need to discuss what is happening with our wombs. I thank you for joining us today on another edition. Our guest for today is Dr. Mandisa Smith, and she is with Maternity Solutions, M&S Maternity Solutions. She has her doctorate in nursing practice and her master's in certified nurse midwife. So we're going to get going, but of course, we always start our show with our intro. And I want to thank Brother Ooyiman for my intro. I always got to give him love and also check out his project because it's now out on every platform imaginable. Without further ado, here's BBI Talks.
We gotta bring businesses back. My business is black. My business is black as the universe. I know why they mad. They gotta react because we're universal influencers. I can supply you the man. Get what I need out the land. The earth is the kingdom of God. Glad that I know where I am. We gotta bring businesses back. My business is black. My business is black as the universe. I know why they mad. They gotta react because we're universal influencers. I can supply you the man. I can supply you the man. Get what I need out the land. Glad that I know where I am.
Dr. Mandisa Smith.
Hi.
Welcome.
Lotus.
welcome to BBI Talks. Thank you so much for honoring us by being our guest. So please introduce yourself. Tell the viewers who you are, who you work with, and what you do.
Okay, so as Professor Lotus said, my name is Mandisa Smith. I'm a practicing certified nurse midwife. I've been practicing for about 5.5 years, and before that was working like labor and delivery and mother baby in ICU. One of my colleagues and I, Sweya Mohammed, CNM, we decided that we wanted to create a business, and our business is M&S Maternity Solutions, LLC. And the reason we wanted to create this business was because, we're kind of sick and tired of Black women and brown women dying at an exponential rate. I mean, death is, from giving birth is awful anyway. But the fact that we are dying at a much higher rate and at least 50-60% of these deaths are preventable, that's a problem. And so we wanted to, create this business, get into the medical system, and just evaluate processes, educate these facilities on what, could be done better to help protect us. And then another part of our business is that we really want to empower and educate our women. And so, traditional care doesn't really do a good job of telling you what's going on with your body, what to expect, how to plan, what is it like having a newborn. And so another part that we plan to do is have patient education for childbearing women. And hopefully that will empower and give them knowledge so they are not fooled by anybody when they enter the medical system.
Awesome. And what would have been, I know you mentioned in terms of you giving the support to the different organizations, but what have you seen as being a prevalent issue among Black women in particular? Like, what are some of the experiences, some of the challenges that you've seen Black women having as it relates to the medical system?
So the biggest overall problem in the medical system is racism. I mean, this system wasn't built for us, therefore it was not built to protect us, and therefore, they might say, "Oh, Black women, we have a higher pain tolerance." Well, that's not true. "Oh, Black women, we complain too much." Well, that's not true. And then also we are at higher risk for certain issues such as preeclampsia, diabetes. We are twice as likely as white women to experience stillbirth. We just have, more severe statistics. And again, that comes from the systemic racism and the history that, Black people in this country, how you originated from, you know what I mean, with the slavery and, how it affects your genetics. So, I mean, it's a huge problem and it cannot be neglected at this point.
Absolutely. Now, I put on the flyer, many have noticed, in the actual flyer, I have a silhouette of Depo, Provera, and the Norplant, which are have been or are popular birth control mechanisms. So can you kind of speak to what these medications do and what the impact is on us, especially as Black women?
Yeah, so basically birth control fools your body into believing it's pregnant. So basically, like most of them, they stop your ovarian function. So basically you're not ovulating during your cycles. And so if you look at Depo, you do one shot every 3 months. So that one shot shuts your body down, your reproductive system down for a whole 3 months. That is very powerful. And I've done it before, not, fully understanding the consequences of. But Depo can basically halt your fertility. So some women, they can take, it's based on the stats on the FDA, it says like about most women will have a return of fertility at about 10 months. But some women, it can take up to 18. And that's not everybody. It's like 90+%, 18 months. And that's what's reported. You know what I'm saying? So that's the issue. Like, I'm not saying don't take birth control, but, if that's your choice. But at the same time, we have to know, well, what are the consequences of it? How's it going to affect my body? Like Depo, 1 in 4 women gain weight and they never lose it. I've had patients gain 60 pounds and cannot shift it because of that Depo. And I've experienced that myself, gaining excessive weight and obviously affecting the fertility as well.
And it's funny that you mentioned that. I pulled an article entitled FDA Board Investigates Depo Provera Safety. And even at this particular time, Depo-Provera was actually pulled from the market for a number of years, I think starting around 1978-ish, somewhere around there. And the reason why they had pulled it is because they had found potential link to breast or endometrial cancer in humans.
Yeah.
As well as osteoporosis, which normally you hear about that being prevalent among Caucasian women, but can you speak to what that is and how that impacts the body?
Yeah, so all birth controls are they're hormones, which is also steroids, right? So,
Right.
They're altering your normal estrogen, progesterone levels in your body, and they're synthetic, so it's foreign to the body. Specifically with Depo is known to cause osteoporosis. So before anyone is put on Depo, they should have a bone density exam. And then it should be repeated regularly. And so per the label, you shouldn't be on Depo longer than 2 years. And I know a lot of people that have been on it longer than that. And they run the risk of having osteoporosis, and it might not be correctable. So
So when we're saying osteoporosis, the loss in bone density, what does that cause? Like, just in layman's
Fractures,
terms,
like
what does that mean?
you can have bone pain, you can easily have a fracture.
Mm,
You know, if you think about your skeleton helps you control movement. I mean, it's
mhm,
muscles and skeletal, like anything that you could possibly think that you use your skeleton for, it can affect that. And it's more so, you know, in the larger bones that you can see that.
Now, I know Dr. Wesley Muhammad has done intensive research about this particular birth control pill, especially, and he has shared his findings. And I encourage everybody who is watching to really go into what he has found in his research. But there was something that you mentioned when we were conversating about this particular show about a intentional push of certain
Mm.
medications to Black women. Can you speak to that, especially as it relates to birth control pills?
Yeah, so in healthcare, Black women are more likely to be pushed birth control, period.
Mm,
You know, they're assuming the stigma that, you know, we're we do have a higher rate of unintended pregnancy, but I mean, 50% of pregnancies are not planned. But they're assuming that we're just gonna be like popping out babies like baby factories, and so like they're more prone to push us to be like, you know, say you say I don't want any birth control, they're like, well, you should be, you know, they really could just keep pushing you to get on the birth control, and you know, which one's going to lock your system down more so than the other. Um,
mhm,
and then there's also if you look at the history, there's, you know, eugenics in you
mhm,
know, in America in regards to Black people, and you know, them trying to control us in that way, and forced sterilization.
mhm,
Um, and so, like, a lot of Black women don't trust the medical system, which I don't blame them. You know,
mhm,
it wasn't set up to protect us. And so, you know, another thing is if you are on a birth control, sometimes these women might not be on something that is as effective as they would like. And
mhm,
that's because, you know, no one educated them. I mean, I think the biggest thing is lack of education, lack of sharing knowledge, and then just being pushed to not be fertile,
mm.
essentially, if you're going to push birth control.
Well,
Yeah.
that's funny that you say that, because ultimately, especially when you're talking about the eugenics movement and the point of the eugenics movement, another point that I was going to make is that, especially in terms of the usage of Depo-Provera, and some of the other birth control mechanisms, they are still being used by Planned Parenthood in spite of the toxic and the harmful impact, which you're talking about a minimum in some cases of 18 months based upon one shot of that particular medication, and a woman can be rendered infertile. But you've also spoke to the fact that women sometimes remain infertile beyond those 2 years. Uh,
Yeah.
and
And
so,
I'm one of them. I can speak to it. I'm one
oh
of them.
wow.
Yeah, yeah. So like the I've gone through the process of infertility myself, and basically every option that there is, I've tried it.
Mm,
So not only can I speak to it from a professional standpoint, I can tell you personally, you
yes.
know, what that's like, and you know, the expense behind it. Because that's
and, and
another
we
thing.
and we're going to get to that too, because
Yeah.
there is a domestic racket around infertility as well as adoption, which is that's a whole nother
That's a whole nother ball game.
for another day, and we will definitely talk about that. But as it relates to this rise, why is it that we as a community don't know that there is a rise in infertility among Black women? Because even when I put this topic out there, I got a little bit of feedback from people. Well, no, we have babies. We don't have problems with that.
Mm-mm.
That's other people that have problems having children. Why is it that we don't know that this is happening?
No one's talking about it, honestly. And you know, when you go for your annual, like how, you know, some people aren't as in depth with, you know, the annual exam.
Mm.
If you go, if so, like, you know, so say you're going for your annual, and you know you've been trying to get pregnant for the past year. One, you might not tell your provider because you might not feel comfortable. That's
Mhm.
another thing that I saw, was a lot of women, Black women, are not verbalizing the struggle that they're having with infertility. So that's the first thing. You got a voice to say something, know what is normal with your body, and know that be okay to say something is wrong. That's how I first had to admit something is wrong with my body, and I need to figure out, why I'm not getting pregnant. So first, that's the first thing. And two, how thorough is that exam? Are they asking you, like, when was the first time you had your first period? How often are your periods? Are they periods? They're supposed to come every 24 to 32 days. Are you outside of that window?
Mm-hmm.
If you are, then that needs to be investigated. Is your thyroid normal? A lot of Black women, we have fibroids. Like, there's a substantial amount of Black women have fibroids, which affects fertility, because if it can affect implantation, it can affect your hormones, your natural hormone levels.
And, and can we pause there for just a
Yeah.
moment when it comes to the fibroids? Because
Yeah,
some
go ahead.
women don't even know that fibroids can be shrunk
Mm-hmm.
and or they can be removed. So you don't have to have an all-out hysterectomy, which
Absolutely not.
many women who are probably 55 or older have gone for hysterectomies. Have you found in your practice, especially, that we in these, Generation X forward are more aware of the alternatives to getting rid of fibroids, or do you find that we're still going back to the old way of just default hysterectomy, remove my womb, that's it?
So the thing, I think, is a knowledge gap. So fibroids are prevalent in the younger population as well.
Oh, wow.
And a lot of it has to do with, kind of our diet, not only just history, but diet too. Like, if we're overweight and we eat poorly, like, there's a big movement about, meat and it causes inflammation. Well, fibroids are inflammation. So that's a big thing, is we need to work on our diet. We need to, be exercising, be more fit to control our hormones, because that's what it is, a hormone response. Now, do all fibroids have to be removed for you to get pregnant? Not necessarily. It kind of, obviously a reproductive and endocrinologist or embryologist would be more knowledgeable, but it's, where is that fibroid in the body? And so, like, having a fibroid doesn't equal removal.
Mm-hmm.
Yeah. And so, but it's I guess removal is a quick fix, but it's not really. You know what I mean? Like,
And
it's a more
it's a
convenient fix.
moneymaker.
Yeah, but it's not. You know what I mean? And then you don't know, like, depending on where the fibroid is and how it's removed, that if you do get pregnant, that can affect how you birth. They might say, because you had a myomectomy, you have to have a C-section,
Mm-hmm.
because it's surgery on the uterus and increased risk of your uterus opening during labor.
Mm-hmm.
So it's I wouldn't take that. If you do have fibroids, I would look at the naturopathic things before I would jump to just cutting it out.
Mm-hmm. And prayerfully, I'll be able to have some sisters on who can speak to that naturopathic way of addressing fibroids and other womb challenges, because it's time for us to go back to the earth,
Yeah.
for our healing. And it's not to say that there's no place for more of an allopathic approach, but we still need to know the holistic way of healing as well. And so we're talking about, as it relates to infertility among Black women, birth control pills and mechanisms like the Norplant, like the Depo, Provera, being a potential cause of infertility, long-term infertility. We talked about fibroids, especially if they grow to a certain size, can be an impediment to fertility. What are some other things that come up that you have found that are a barrier that may cause this rise in infertility among Black women?
So there are a few causes of that can lead to infertility. So ovarian dysfunction, that's when you don't ovulate. So some women, that's either because of the birth control, or they got a hormone imbalance, or they might have an issue with their thyroid. That can be another problem. Your weight, if you're extremely overweight or underweight, that can affect ovarian function. And whether you're having irregular periods or you're not having any periods at all, like you shouldn't be having them. So just looking at those factors. Another issue could be so some women, they have scar tissue in their tubes. That you mean you wouldn't know that. So so one way to figure that out is to have a HSG, and that procedure is where they go through your cervix, and it's basically an X-ray. They release dye, and it sees if you have patent, which means open, your tubes, your ovarian tubes. So that's one thing, and the proper term for that is a hysterosalpinography. That's the proper term.
Okay.
But yeah, so I've experienced that, and one thing I do want to stress to women is, like, when you do tests, they can be painful, and it's okay to express that it is painful. Because I've experienced that, and I feel like, again, with the history that, we don't experience pain, which is totally false. Yeah, so you want to make sure those fallopian tubes are open. And then another thing is, obviously if you have any polyps or if you have any fibroids, and the test that you can do for that is a sonohysterography. Yeah, long word. So basically, that's an ultrasound. It's a saline ultrasound, and they can see if you have any of those. But another thing that you need to factor in is that 40 to 50% of infertility is a male problem. It's not just women. So, one thing is, some couples, like, the man might not want to be tested, and it's like, well, yeah, you have to get tested. And the test for that is a semen analysis. And so basically, like, the man would not want to have sex or express semen for about 2 to 5 days, and then they go to the lab, ejaculate in a cup, and they look at your semen, look at, is the head normal, is the tail normal, is it swimming normal, things like that. And the semen analysis, it can vary some, like, you might have a great one and a not so great one, but it's important to look at that.
And I'm glad you brought that up, and that was the reason why, even in the announcement, I made sure to say, attention, queens and kings.
Yeah.
Because even though the topic is talking about the rise of infertility among Black women, it takes two of us to
tango, right?
Tango, okay? So we're not, look, I'm not talking about where the technology allows us to do. I'm talking about the natural way in which we do things, okay? And I don't want to be graphic about it. But it's important for us to understand that this conversation has to be the conversation between us, between ourselves and our man, our Black men, So we have to be able to speak intelligently with one another about what needs to be done. Now, when we talk about, and do you still use the language infertility when you're referring to men?
Yeah.
Yes. Okay. So when we're talking about infertility, look, I'm still learning. Look,
no, you're good.
I appreciate you being here, because I have an expert that I can ask these questions. So when we're talking about infertility among men, I know that you said that there's an analysis that takes place. So it's the mobility of the sperm that's checked. The what are the other aspects?
So they're looking at the there's 3 parts to the sperm. So the biggest part is the head.
Right.
So that's where all the genetic material is.
Okay.
And you might, first of all, the man might have a low sperm count.
Okay.
I mean, there are men that might release one sperm, but they wouldn't know. They wouldn't know unless you check. And then there's some, where the morphology, like, they might have a sperm with 2 heads on it. Well, that's not going to work either. Is it swimming in the right direction? So yeah, so they look at all of that. Like, there's a whole list on the analysis of what they're looking at, and then, like, they might look at the sample and then look at the sample washed. So a washed
Right.
sample looks at how many normal sperm do you have. Yeah.
And so when we talk about some of the things that become challenges for men, it could be stress level, it could be diet, it could be
Hormone.
hormones, which you don't really hear us discuss a lot as it relates to men. You only hear the hormone conversation as it relates to women. Can you speak to that a little bit more? Like, what do you mean by the hormone?
So men, they have testosterone. That's their core hormone, and so if that's abnormal, that can affect their sperm. Or another thing is like their anatomy, is that normal? Some men, the testes are outside the body for a reason. It's because they're not supposed to get hot, and so if you have men that excessively get hot down there, that could affect their sperm quality as well.
And then also we're talking about the usage of alcohol.
Yeah, and smoking. For both men and women.
For men and women, and drugs. So
Yes.
like the marijuana, the one that's a big drug. And now having been legalized is probably being used even more than ever. And of course the narcotics, narcotic drugs. I want to shift into back to women in particular. What is it that a woman can do? Because I'm gonna tell you this, like my husband and I, we've been on our own journey, right? And so we've learned probably more about fertility and anatomy and all those good sciences probably in this past year than we probably have our whole lives. And I know that we're constantly learning new things. But what are some of the things that we can do as women? And even can you also share what are some things that men can do that will help us be more healthy when we approach giving birth to gods? I say that because it's based upon a lecture series that the Honorable Minister Louis Farrakhan did on how to give birth to a god. And we should be following the instructions in that. However, one of the other things we need to realize is that there's also a medical component that we need to be aware of as well that plays its part. So can you speak to that, please?
Yeah. So I highly encourage people, you should get a preconception counseling visit. So what that looks like is looking at your overall health, both of you. Like what's your diet like, what's your exercise like, and then also there's genetic counseling, there's a genetic portion of it. So you can look at your own genes and see if you have any recessive traits that might not be compatible with life or might cause, extensive disease in your offspring. So the reason I say that is because like me and my husband did it, and I had one trait and he had another trait, but they were different. So we didn't have to worry about that being a reason as to why we weren't getting pregnant. So that's where I'd start. Know your cycle, know your body. Like, I noticed something was going wrong because I downloaded an app and I tracked when did I have my cycle. And I could see it was all over the place, or I was bleeding for like 3 weeks straight, which, I mean, obviously I know this. I can tell I'm bleeding for 3 weeks straight, and that's not normal.
Right.
So I would start with that. Another thing you can do for yourself is you can buy LH strips. So LH is the hormone that when it surges, that means you ovulate. So it's really cheap. You can buy them anywhere. And they're little strips, and you just pee on them at the same time every day. And some like to start at the beginning of a cycle, just so you know where you might surge. So you can detect whether you're not ovulating or not if you have ovarian dysfunction. If that line is flat the whole time and then you have a period, well, guess what? You didn't ovulate. What's wrong here?
And one of the things you also mentioned is that a woman can still be having a cycle and not even be ovulating. That
was me.
Synonymous.
Yeah, that was me.
How would a woman know that? Where would she go to find out that information?
Those LH strips?
Okay. So
So
that
if
was
you look, yeah. So there's apps that you can buy. You don't have to buy an app. You could literally like put your strips on a piece of paper and watch the line. Is it getting darker, darker, darker? Because there's a control line and then there's a test line. And
got you.
so you want your test line to be as dark or darker than your control line.
Mhm.
So that would tell you that you're surging.
Now,
So I noticed that mine was just straight flat. It wasn't doing anything.
now with M&S Solutions, Maternity Solutions, what is it that you offer organizations as it relates to this wealth of knowledge that you have in helping women with fertility challenges as well as infant mortality challenges?
So we haven't thus far, like we're brand new. We just started on January 1st. So we have not looked at it from a fertility standpoint, but more from a maternal mortality standpoint. So
Mhm.
what our goal is, when we get a client, is to go in there and do a survey, do an analysis of what is currently happening, and then see, what needs to be done to fix it, make it the process more effective, make it safer for
Mhm.
our patients. Are they culturally competent? Do they have providers that look like them?
Mhm.
Because that's another thing. They're not enough of us taking
Mhm.
care of us.
Right.
But just things like that, and then implementing changes and looking at policies and improving the situation for us.
Awesome. Well, I just want to thank everybody who is on Instagram for joining the show. Thank you on Facebook as well as YouTube for joining the show. If you have any questions, please feel free to either put it in that little chat box there, or you can feel free to put it on. I'll just post it directly onto the thread for this show. And I will be sure to ask our very special guest, Sister Dr. Mandisa Smith, any questions that you may have as it relates to fertility or infertility for men and for women. I want to thank also Sister Sawiya Muhammad, which is your partner, for connecting the two of us and giving us the opportunity to honor and to highlight your wonderful service that you're providing. And of course, we have to understand that you guys have been doing this for a long time. However, the consulting part of it is what is new. So I want to be clear
Mm-hmm.
about that.
Yeah.
I don't want
Yeah.
anybody to have any misconceptions about who is before us. And I also want to give a special thank you to our wonderful sponsors. The National Reparations Institute. You can actually download the declaration. It is ready, and it is ready for you to find out the different forms of reparations that we can get and should get and will get. So please log on to reparationsinstitute.org and you can get that wonderful information. And I want to thank Ninth and Maxwell, which is a vegan nail polish line, Dr. Smith.
Mm.
And it's a sister, a wonderful sister. So we want to thank
Okay.
her for her sponsorship as well. She gave it during my birthday bash a couple of weeks ago. So I want to thank you for that. And if you desire to be a sponsor on BBI Talks because you believe in the issues that we discuss on this show, and sometimes the issues are a bit edgy and sometimes they might make you a little uncomfortable, but guess what? These are conversations that need to be had. And this is the format in which we have chosen to have them. So this is where we are, right? So, but if you desire to be a sponsor, you can feel free to email me. My information is actually on that little crawl line that's coming down today. Let's see. Let me change that. Make sure that you can see it. Here we go. It's right there. So it's at yearoflotus@gmail.com. Feel free to send your information and we'll talk. Or if you just want to give a love offering, I accept that too. You can send a love offering to my Cash App, which is Cash App $ Karriemah Lotus. Okay. So now we've taken care of all of the business. Let's get back to this rise in infertility. So, what are some of the things or what kind of conversations can we have with our men as it relates to supporting women, and as well as us as women supporting our men? What is that we can do together to help us?
I think transparency
Mm-hmm.
is important and gaining the knowledge together. So, from a personal experience, I'm very, independent, gonna get mine, put the work in, blah, blah, blah. And I had to slow down because I got to a point where I was very vulnerable because I felt like my body was failing me. And it was, I would say, it would be the first time, me and my husband been together since I was 19 years old. It was
Wow.
the first time that I actually had to lean on him and be vulnerable and say, you know, it's messing me. Like you feel defeated. You feel like, you don't know what to do. I mean, I know medicine, but it's like, why is it happening to me, kind of thing. And so that relationship, that bond, that going through it together, both gaining the knowledge, no one's blaming anybody. It's like, okay, what test do I have to do? What test does he have to do? That brought us so close together in a different, kind of way. So I think that's the biggest thing. And, acknowledging that mental health. I mean, if you can imagine, I'm a midwife, I'm catching babies regularly, and I can't have my own. You know what I mean? Like, you have to mentally, like, prepare your brain and be like, okay, I'm going to accept this, but I'm going to do something about it. And I think that's what a lot of us don't do. We don't do anything about it.
I'm a firm believer in the sisterhood. I think the sisterhood is critical to our survival as a people and our survival as women and girls.
Absolutely.
And so when I think of yes, having the vulnerable conversations with our men, that's important, and I would never take away from that. However, having the support of our sisterhood to know that you're not alone, or to know that someone else cares that you're experiencing the challenges that you're experiencing, is important. In addition to that, the power of the sisterhood in terms of sharing with one another. Like I tell my younger sisters all the time, don't assume because you're younger that when you're ready to have children, it's going to poof happen with no problem. Take the necessary steps to having yourself evaluated. And so I wanted to ask you, what are those evaluative tests that women can take to kind of know where they stand?
Yeah,
And then
definitely.
and then that's the first part of the question. And then the second part of the question, what are some of those limitations too for each one for those tests?
Yeah, so I'd first like to say that I'm glad you brought up the sisterhood, because I did have my sisterhood. I had my circle of
So,
women that I talked about it, and they help keep me sane as well, and
yeah.
keep me on task, if that
Mhm.
makes any sense. So in regards to tests, so what they can do is look at your FSH hormone, and look at your estrogen and your progesterone. And so FSH, like if it's elevated at the beginning of your cycle, that can mean that you have poor ovarian reserve. Okay.
Okay.
You want to make sure that your estrogen is normal, because your estrogen helps increase the progesterone and also helps with the release of the egg. Progesterone should elevate after you ovulate. So if your progesterone isn't increasing at the latter part of your cycle, then that means you probably didn't ovulate. Another hormone that I can look at is the anti-Mullerian hormone, AMH, and that looks at your ovarian reserve as well. So just like getting a basis of, where do I stand now normally off birth control? Um, so looking at that. And then depending on your age and your situation, because obviously your fertility declines at about age 31, 32. You considered advanced maternal age at 35. 40, you have a really high chance of not being able to conceive, just because your age, your ovaries are getting older and things like that. So you would want to see a reproductive specialist, just to have a consult. Where am I? Could I preserve my eggs that I do have? You'd basically do an IVF cycle, which is where you stimulate your ovaries, overstimulate your ovaries to get as many mature follicles, and then they retrieve those follicles and get the egg out of them, and then then you can either freeze them, or if you're actively trying to get pregnant now, you'd obviously fertilize them with your partner's egg, or I mean partner's sperm or donor sperm, whatever your situation is, and freeze those. So it kind of depends on like your age and where you are, but definitely show respect to your reproductive organs, and know where they are, because you don't want to wait until the appointed time and it's too late. The stuff you could have done before, make informed decisions.
Absolutely. Stress level. Can we talk
Yeah.
about the stress level and how that impacts fertility?
Yeah, so stress equals negative impacts on your fertility completely. Um, you hear a lot of people like they'll tell you, "Oh, just relax, you're too stressed out about trying to get pregnant and all that stuff." Or your job, like, being a midwife, always wondering, being up all night and taking 2 days to recover and then you're back at it, like, that very well could have affected my fertility, just because, if you're not sleeping properly, your body's not recovering, and that can affect your hormones as well. So yeah, and as Black women, we are under more stress than others, and so that definitely can have a negative effect on your fertility, and you can do things, what stress, we have to figure out how we're going to respond to it and what we're going to do with it. So whether that's meditation, deep breathing, or going out and exercising, whatever you do, as long as it's not like smoking or alcohol, that's not going to help you.
Right.
What you do to cope with your stress, you have to figure that out as well.
Prayer, meditation,
Yeah,
long walks. Look, get
yeah,
your Jill Scott on if you need to. Have it a long
exactly.
walk.
Fresh air.
Yeah. And it's so funny because you mentioned stress among Black women, especially, like, we just carry so much.
Yeah.
We carry so much. We carry a great amount of weight, from the type of work that we do, to our role in our families, to our role in our communities. And then we can't also take off the table the impact of social injustice,
Mm-hmm.
the weight of racism and prejudice and discrimination, and that impact that we hold. I didn't realize till I had the opportunity to live overseas, and I was not greeted with overt racism, that the stress was just lifted off of my shoulders. Just the freedom of just being able to go where I want to go and not have to worry about, okay, am I going to be pulled over because I'm a Black woman riding in such and such vehicle in a such and such neighborhood? Like, that was not a stressor for me there, right? But that is a stress that we go through every single day in this country.
Mm-hmm.
And so I don't think it's an accident that, like you talked about, the intentional pushing of medication on us, but also the stress level of this social injustice and our experiences, even in current context, what its impact is on our fertility. So is there anything else that you want to kind of share with our viewers of some of the things that they can maybe take away from this conversation?
Know your body. Don't be afraid to get help. There's a lot of options. There was two options I actually didn't mention. So one of them is IUI, which is where they do ovulation stimulation, and then they introduce the sperm through a catheter to your uterus at the point of time when you're supposed to ovulate. So that's another option. It's not as effective, but they say, like, you know, about 20% of women that might be helpful. And then obviously the IVF, the sooner you do that, the younger you are, the more successful it can be. But I would just say, don't be afraid to take charge of your body, take charge of your knowledge, and seek the help that you need. Build your group, your village, your sisterhood. If you pray about it, and just know, like, it can be you. I'm sitting here and I'll say, I'm officially pregnant. It can be you. Like, you can do it, and it's just, it might be a lot of process. It might be there might be a lot of pain. I experienced a lot of pain. Like, I can't imagine back in the day when they used to do this stuff to us and experiment on us with no medication. Like, some of the stuff I experienced, I went to sleep for. I'm like, conscious sedation, thank you. I'm like, yeah, not going to be able to tolerate that based on the last procedure, which is similar to this one. I need some conscious sedation. Thank you. But yeah, and advocate for yourself. Like, don't let them punk you.
I love
that.
Advocate for yourself. Don't let them punk you. There was one more thing that I wanted to bring up, and that is the cost, because oftentimes that is the barrier for us.
Absolutely.
After knowledge is cost.
Mm-hmm.
And so one of the things that is wonderful is that we have options now that maybe our mothers and grandmothers didn't have.
Mm-hmm.
We have the holistic way that you mentioned earlier. And typically, your average holistic practitioner will charge anywhere from maybe $300 to maybe $1,000 for a series of medication. Well, I don't want to say medication,
Supplements.
but herbal supplements. But then you also have a lot of insurance companies that are now covering IUIs, and we talked about that as well. Yeah. Can you kind of share what part of the treatment perhaps that they will cover versus what they won't cover?
Okay, so a lot of over here, naturopaths are usually not covered under insurance, so you are going to come out of pocket. So I did try Mayan massage, and I did try acupuncture. They weren't successful for me. I mean, they've been successful for other people, but I did have to pay out of pocket for that. Definitely look at your insurance. So even though I work for a hospital institution, my insurance that I had through the hospital only covered the diagnosis of infertility. So once I had all the, had a few ultrasounds and that HSG, after that, they wouldn't pay for it, anything. And I got slapped with a $300-400 bill for an ultrasound. So definitely know what's included with that. Now, when I got put on transition to my husband's insurance, they covered $20,000 towards procedures and $5,000 towards medication.
Awesome.
So yeah, so that was our saving grace, because we were like, we don't have 20-30 grand sitting around. I mean, a lot of people don't. So that was a big relief for us. But yeah, so it just depends. So like, for example, his insurance, it would cover IVF, traditional IVF, but it wouldn't cover Imbecile. So Imbecile is like IVF. It's a little device that they put the sperm and the egg. They put it in this little device, and it goes in your vagina, and it sits in there for 5 days, and then you take it out and you see how, what you got. So basically, the mom's a lab, but see, his insurance won't cover it. Mm-hmm. So that's why we went with traditional IVF. But yeah, so it just depends. Like, definitely, like with everything, I've called insurance, even now to, giving birth, and what options do I have with that? Who's in network, who's out of network? If I go out of network, what does that look like? Mm-hmm. So you really have to plan.
Well, I will say this, this conversation, and I thank you so much for being on with us today, Dr. Smith. I think this is a conversation that definitely needs to be had. We need to know as women the things to look out for, how to advocate for ourselves, the ways in which we need to relate to our men in this process. As well as the options that we have to help pay for some of these treatments. I was just very pleased to know that there are some insurance carriers that do cover, a great amount of procedures. And then also there are options where people are going abroad.
Yeah, they are.
To have, and they're finding great success. As a matter of fact, I spoke with a young lady last week that her and her husband didn't go not once, but twice overseas. And they are pregnant with their second child.
Awesome. Congrats.
Oh yes. And so it can happen. And I think like I said before, the options that our mothers and our grandmothers didn't have, we now have today. But it's important for us to know that these are options to us. Even in the midst of this pandemic, there's still a need. And
Absolutely.
and there's still a window of time. And I know that there are those who believe, well, no, there is no window for women. That's, we were just taught that to da da da. Okay, wherever you stand on the issue, it's important for us to educate ourselves. So if you are firm in what it is that you believe, then share what it is that you have and bring your receipts, as the young people would say, with you, your proof, your research that bears witness to what you're sharing. But it's important that we have these types of conversations. And I thank you. There's been parts of the conversation with a nail biter, but but we're okay. This is definitely a conversation for the mature adult. This is a conversation for those who can, stand to listen to the names of our anatomy and understand that it's in context. And so I just thank you so much just for sharing everything you shared on this show. And I thank your partner as well, Sister Sawiya Muhammad, for bringing us together. And this is just another wonderful addition. A lot of people, they ask me, Dr. Smith, why are you talking about all these issues on the Black Business Influencer? And one of the things that I was sharing is that, look, as business owners, we can't just read about just business. We can't just know just about business, because that's what we have lives.
Absolutely.
So we have to talk about many different types of issues, because guess what? All of them impact the quality of the business that we provide. If you have somebody who's in business and they're having these personal challenges, let's say with infertility, guess what? It's going to find its way into your business. So why not just discuss these issues and find out what you can do to resolve that? So that way, when you go out and you're putting out your best foot forward for your business, you do it with a certain amount of confidence that maybe you didn't have yesterday. And so this is why we do what we do here. This is why we have these conversations. This is why you and other guests that I've had on this show are so exceptionally important to this show and to this platform. So once again, sister, thank you.
Thank you for having me. I'm glad to finally be able to share. You know what I mean? Can't keep this to myself. I know too much, been through too much.
Yes. And there are other platforms for sisters who are presently going through, like she said, claim that you will be successful in having a child. And having a child, whether it be physically or having a child through adoption or having a child through any other way of simply adopting informally a child in your community and making that child one of your family members. However we do it, claim it in the name of the creator that you serve, that we serve. And so without further ado, I'm going to close out this show. And I thank you. Thank you to Instagram, those of you who are watching, for joining us. This has just been a wonderfully informative show. Looking forward to seeing you again next week, Wednesday at 3 p.m. Eastern Standard Time. And then, of course, we can't forget, guess what, Dr. Smith? We are also in South Haven, Mississippi and Memphis, Tennessee on content. Channel 16, Saturday mornings at 11 a.m. Yeah.
Excellent.
So I'm looking forward to getting the feedback from that show as well. We are actually broadcasting out of New Mind, New Nation, which is the name of the show that we are broadcasting BBI Talks through. So you'll be able to check us out there as well. And so thank you so much. This is BBI Talks.
We gotta bring businesses back. My business is black. My business is black as the universe. I know why they mad, they gotta react, cause we're universal influencers. I can supply you the man, get what I need out of the land. The earth is the kingdom of God. Glad that I know where I am. We gotta bring businesses back. My business is black. My business is black as the universe. I know why they mad, they gotta react, cause we're universal influencers. I can supply you the man. I can supply you the man. Get what I need out of the land.